Progestagen-only contraceptive carry similar small breast cancer risk as other hormone contraceptive. Study finds the overall risk of breast cancer among the hormone contraceptive users is low, especially for younger women. CNN or hormone contraceptive, including progestin only mini pills, carry a small excess risk of breast cancer, according to a new study by researchers at the University of Oxford. But the overall risk remains low. The study published Tuesday in the journal PLOS Medicine bridges a research gap by investigating the link between breast cancer and the progestin-only contraceptives. Use of combined oral contraceptives containing both estrogen and progestin has previously been associated with a small increase in breast cancer risk, but there is a limited data about the effect of progestin only hormonal contraceptive, the authors wrote. The study found that progestin only contraceptives are associated with a 20% to 30% relative risk for breast cancer, which aligns with the previous research on combined hormone contraceptives. The overall risk of breast cancer among hormone contraceptive users is low, especially for younger women, and the past studies have shown that the excess risk is gone entirely about 10 years after stopping. The study does not indicate that the hormonal contraceptives cause breast cancer, but rather investigated the potential links to the disease. What are progestin only contraceptives? Progestin or progestin are a type of synthetic hormone drug that mimic the nature hormone progesterone, which is crucial for men's menstruation and pregnancy. Unlike combined hormone contraceptives, progestin only contraceptives do not have estrogen. Types of progestin only contraceptives available in the UK and the US include the implant, the hormonal intrauterine device called the IUD, the contraceptive injection, and the mini pill. In the UK, which is ranked the highest for access to contraception on the 2023 Europe Contraception Policy Atlas, prescriptions for progestin only contraceptives are almost as high for combined oral contraceptives. In the US, the combined pill is the most popular hormonal contraception, but a significant percentage of women are choosing an implant or IUD, according to the US Centers for Disease Control and Prevention. Progestin only contraceptives work to prevent pregnancy by thickening mucus in the cervix to stop sperm reaching an egg, and in some cases can stop ovulation completely. The CDC and the British National Health Service also cite additional benefits. For example, women who have severe period pain and often advised to opt for the implant or IUD, as progestin only contraceptives can weaken or stop periods for some women. This can serve as the more sustainable and affordable option for a long term pain management for conditions like endometriosis. The mini pill is also cited as the safe option for women who are breastfeeding. Like combined hormonal contraceptives, progestin only contraceptives are designed to prevent unwanted pregnancies but should still be used in tandem with condoms as they do not protect women from sexually transmitted infections. Risk versus benefits. The new study analyzed the data on almost 10,000 women under the age of 50 in the UK who were diagnosed with invasive breast cancer between 1996 and 2017, as well as more than 18,000 who did not have breast cancer. On average, 44% of women with breast cancer and 39% of matched controls had the hormonal contraceptive prescription, with about half the prescriptions being for progestin-only preparations, the study stated. The clinical practice research data link, which collected the data for the study, also combined the result with the previous research, including women from the wider age range. The resulting 15-year excess risk associated with 5 years of use of combined or progestin-only contraceptives in high income countries was estimated at 5%, 5.8 per 100,000 users ages 16 to 20 and 265 per 100,000 users ages 35 to 39. Christine Peary, a researcher at the University of Oxford and the lead author of the study, said excess risk must be viewed in the context of the well-established benefits of contraceptive use during a woman's pro- productive reproductive years, such as birth control and hormone regulation. Peary also noted that breast cancer risks are lower for younger women, given that the underlying risk increases with age. Clary Knight, a senior health information manager at Cancer Research UK, which provided the core funding for the study, said that hormonal contraception is a personal choice as there are lots of possible benefits to using contraception as well as other risks not related to cancer. Women who are most likely to be using contraception are under the age of 50, where the risk of breast cancer is even lower. For anyone looking to lower their cancer risk, not smoking, eating a health, healthy, balanced diet, drinking less alcohol, and keeping a healthy weight will have the most impact, Knight said. Limitations of the research. The researchers noted some limitations in their study, including a lack of complete information on the woman's prescription history. However, while that limitation affected the ability to assess the long-term associations of contraceptive use with breast cancer risk, the authors say it is unlikely to have disproportionately affected the short-term findings. The study says data was lacking on the family history of breast cancer, but the researchers said that previously published findings for combined oral contraceptive were unaltered after adjusting for family history. The authors also said they attempt to investigate whether there are differing breast cancer risk between hormonal and non-hormonal IUDs. However, they said too few women in England had been prescribed non-hormonal IUDs to make a reliable comparison.